Does your horse resist or refuse the bit? Mouth pain can make a horse less responsive to the bit. Some horses have no tolerance for pain and act out by becoming resistant. Some will act in the opposite way, becoming spooked and likely to bolt at every opportunity. Is your horse bucking at times? This may well be a sign your horse is experiencing mouth pain. Lack of water can lead to choke, inability to get the nutrients needed from his food, and impaction colic. Is your number one fear for your horse colic? You're not alone. To reduce colic, we must first understand all the contributing factors that have a role in causing it. Grinding of grain into small particles is necessary for proper digestion. Hay needs to be chewed thoroughly to prevent impaction. If your horse has mouth pain, he will often shortcut chewing. The result is an increase in the incidence of choking that occurs in horses with mouth pain. Does your horse drool? This can be a sign of ulcers, cuts in the mouth, or that something foreign is embedded in the gums, tongue, or palate of your horse. For example, foxtail, sticks, wire, etc. Is your horse dropping food? It's highly likely that your horse is experiencing pain while chewing. To alleviate this, horses adopt unusual chewing patterns and thus drop food. It's one of the most common signs of mouth issues. Does your horse salivate excessively? Horses' bodies often increase saliva production attempting to lubricate something sharp or to make chewing and swallowing feed easier, again in response to pain. Is your horse expressing resistance or undesirable behavior? It's worthwhile to investigate why. It's not always a training issue he's simply refusing to do. Your horse may well be in pain originating from his mouth. Horses have no ulterior motive. They simply seek relief from discomfort. Is your horse exhibiting head tilting? Very often, this is a sign of mouth or tongue problems such as painful abscesses and lacerations. Is your horse head shy and will not let you touch, groom, or put the bridle on? A distressing mouth condition is commonly the cause. Is your horse tossing its head, difficult to handle when riding, or both? These are both common signs of a very sore mouth because of broken or loose teeth, gum issues or disease, periodontal pockets or ulcers, just to name a few of the excruciatingly painful mouth conditions your horse may be suffering from. Does your horse suffer from lameness? You may be surprised to learn that if your horse's mouth hurts, it can easily be misdiagnosed as lameness. Mouth problems can also cause or intensify lameness and back soreness as horses move in an unnatural manner in an effort to relieve mouth pain. For example, pain on the right side of the mouth can show up as left hind lameness. Because they can mimic lameness issues, potential mouth problems need to be eliminated before a lameness exam. Is there a bad odor coming from your horse's mouth or nose? This might be the only sign that there is an infection of the gums or elsewhere that needs treatment. Foul breath can also often be a sign that food is packed between your horse's cheek teeth. This is called feed packing. It's painful in itself and leads to very painful gum disease. Is your horse's movement when riding off? There is a direct muscular connection between your horse's mouth, front legs, and the continuous chain of muscles all the way to the hind legs, the power plant. An aching mouth or sharp teeth can all but paralyze movement. To move well, your horse must have a relaxed, pain-free mouth. Is your horse not eating his hay or grain? The first signs that your horse has a mouth issue may be subtle. Your chowhound gelding who never misses a crumb is not cleaning up his hay, or your lovely pleasure mare suddenly resists eating her grain. Both could be stemming from a tooth and/or gum problem. Does your horse paw? You know that familiar scrape, scrape, scrape coming from your horse's stall. The one where those front hooves dig rhythmically through the bedding and against the stall mats or floor surface. If your horse paws, and not because he hears the feed bucket rattling, it could be sign of discomfort stemming from his mouth. According to veterinarian Catherine Hoop, Professor Emerita at Cornell University's College of Veterinary Medicine in Ithaca, New York, horses seldom do something that doesn't have a purpose, and that purpose isn't to be annoying. Rather, that purpose might be to alleviate pain. Does your horse have performance issues that weren't present before? Your usually soft in the mouth, responsive gelding has started throwing his head in the air when you pick up the reins or ask him to collect. While the behavior might be frustrating for you as the rider, it could be just as frustrating for him. His teeth might hurt. Often these problems are subtle or not even recognized as related to the teeth. Anytime a horse shows sudden change or resistance when working with a bit in his mouth, 9 out of 10 times, the source of the performance issue is pain from issues in his mouth. Is your horse a sloppy eater? Are there half-chewed mouthfuls of hay in the stall or handfuls of pellets dribbled around the feed tub? Messy eating is more than a bad habit and a source of weight loss. When a horse partially chews food and much of it drops from the mouth, it's called quitting. This is a sign of painful mouth issues interfering with the natural chewing motion. Does your adult horse have an asymmetrical swelling? Young horses can develop normal symmetric bony swellings called eruption cysts in response to the eruption of the cheek teeth. If the swellings are asymmetric or your horse reacts with pain on palpation, then consider them abnormal and requiring treatment. Have you noticed your horse squinting? Most likely, it's a key sign of excruciating pain that has nothing to do with the eyes and everything to do with either the mouth or sinuses. Tooth pain, ulcers, gum abscesses, gum disease, or sinus infection caused by gum disease are just a few possibilities of what needs to be treated. Your horse is trying to tell you this. Did it seem to come on suddenly out of the blue with no warning or apparent reason when your horse threw you? Behavior changes like this can be baffling, upsetting, and frustrating. What is most overlooked is that your horse was actually trying to tell you he has intense pain in his mouth. How do you act when you have a toothache or your gums are so sensitive you can't even eat? Exactly. Has your horse lost weight? Mouth problems are a significant cause of weight loss. If your horse cannot properly chew and digest feed, nutrients cannot be utilized in the body. Does your horse have none of the demonstrated signs? Your horse can still have moderate to severe mouth problems without showing any signs. While horses exhibit many different symptoms of mouth pain, horses are very stoic animals, and many show no pain, suffering in silence. We don't want this to be your horse. A perfect example is new key client Whitster. Whitster is a 23-year-old gorgeous Dane, a former dressage champion just diagnosed with EOTRH, but as you can see, showed no signs. His equine vet recommended key supplement and topical gel to his mom of 15 years. With EOTRH, that means avoiding extractions, keeping him eating, comfortable, and slowing the progression of the disease. There is no cure, but Key has had remarkable results. We will be following his journey.